The Henle-Koch postulate. The postulate can be freely formulated as follows. The microorganism must be found under the condition corresponding to the pathological changes and clinical courses of the diseases in question. It must be possible to cause an identical human or similar animal diseases with pure culture of the pathogen. The pathogen must not occur within the framework of the other diseases as an accidental parasite. Those postulates are still used today to confirm the cause of the infectious disease. However, the fact that these conditions are not met does not necessarily exclude a contribution to disease etiology by pathogen found in the context. In particular, many infections caused by the subcellular entities do not fulfill that postulate in their classic forms. Now read about the present. The frequency and deadline of infectious disease throughout thousands of years, human history have kept them at the focus of the medical science. The development of the effective preventive and therapeutic measure in the recent decade has diminished and sometimes eliminated entirely. The grim epidemic of smallpox, plague, spotted fever, diphtheria, and other such contagions. Today, we have specific drug treatments for many infectious diseases. As a result of this development, the attention of medical researchers was diverted to the other fields. It seemed we had trimmed the infectious diseases. Recent years have proved that assumption false. Previously unknown pathogens causing new diseases are being found, and familiar organisms have demonstrated an ability to evolve new forms and reassert themselves. The origins of this reversal are many and complex. Human behavior has changed, particularly in the term of mobility and nutrition. Further contributing factors was the introduction of invasive and aggressive medical therapies, neglect of established method of infection control, and of course the ability of pathogens to make full use of their specific genetic variability to adapt the changing conditions. The upshot is that physicians in particular, as well as other medical professionals and staff, urgently require a basic knowledge of the pathogens involved in and genesis of infectious diseases. They are to respond effectively to the dynamism in the field of infectiology. The aim of this textbook is to impart these essential to them. So that's the table of aspect medical microbiology. Next lecture we read about the pathogens and subcellular infectious entities.